All right, I see a bunch of people are joining our question and answer session this evening. So I just want to extend a big welcome on behalf of the Margaret Hackett Family Program. We're really excited to have you all here with us tonight. We really hope to be having more events like these in the future. And this is really just a time for all of you just to get to know a little bit more about us. I am Julie Dressler, and I am the new program manager on behalf of the Margaret Hackett Program. And today I've also got with me neurosurgeon, Dr. David Frim, and I've also got with me nurse, Judie Holleman. So today we just want to provide you with more information about the Margaret Hackett Family Program and just all of the great resources that we have, all of the great things that are going on here at the University of Chicago. And we also just want to take some time to tell you about Margaret's story and just how we got started in all of this. So as most of you know, this is a question and answer session. So we've already prepared a few questions ahead of time. A lot of you have submitted questions through email. So we've compiled all of those and we've got those ready. So I will go ahead and I will moderate some of those questions to Dr. Frim and Judie. But if you wish to submit additional questions, please use the chat option on Zoom to send your questions in to Rosa, who is our host. So before we get started in the question and answer session, I just wanted to give everyone a little bit of a session about the program, or a little bit of background about the program. So the Margaret Hackett Family Program was established at the University of Chicago just about 3 years ago. So we're really just getting started in this program, establishing research and really just trying to find resources for families at this point. So the Margaret Hackett Family Program, we are committed to just really helping patients with congenital anomalies in the central nervous system is really our focus. And we've got quite a few initiatives going on right now. So first of all, we really work to establish a network of medical experts who are committed to the care of children, committed to the care of adults with these congenital anomalies in the central nervous system. So if there's anybody out there, who is looking for a physician, who's looking for a provider, we can definitely help get you resourced, with somebody who can really, just meet your needs, somebody that you can talk to. And besides, having a really great network of physicians that you can trust, we've also established various research initiatives here at UChicago. But not only do we have research going on here at the University of Chicago, we've actually established a research consortium that is composed of various institutions around the country. So through all of this research going on, we just really hope to provide better care and treatment for all of these congenital anomalies. And besides our research, our physicians, we also are partnering with various organizations to provide resources, for many of the children and adults that come through our program. So we also want to be an advocate for everyone as well. So we want to walk you through any questions that you might have, regarding your doctor's appointments, anything that you need with a follow-up, if you need help with, navigating hospital procedures. We can also provide information on counseling, therapy, or even, recreational activities such as adaptive sports. We can also, we really want to get you plugged into community and want you to get to know people as well. So we can also help you find a support group, just so you can talk through, people who might be facing similar situations. So our hope today is that we can provide you with more insight into the program and resources to navigate your journey. So like I said, I've got some questions that I will be going through to kick us off. But if you have a question, just send them in through the chat and then I'll be monitoring those questions as we go. So we'll go ahead and we will kick off the session with the first question. So the first question is for you, Dr. Frim. So would you please introduce yourself and can you talk about your practice and the conditions that you specialize in?
So I'm David Frim. I'm a neurosurgeon at the University of Chicago, and I've been here for a long time. I think it's about 25 years. I was delighted a few years ago to have the opportunity to help put together the Margaret Hackett program that's just been growing over the last couple of years and giving us a lot of extra energy to try and make everything work and to do the things we want to do as far as getting more answers with our research and doing more care and, as for me anyway, surgeries to help the children and the adults who are in need of that. I think I'll stop there and ask Judie to say a few words about the nursing staff also.
Okay, so I'm Judie Holleman. I'm one of the pediatric nurse practitioners at the University of Chicago. And I'm one of the nurses, so hopefully soon to be many nurses, but involved with the Margaret Hackett Family Program. It has been my great privilege to take care of many children with congenital disorders within the context of the University of Chicago. I started in the pediatric ICU, so I saw many patients there in need of critical care. But then as a nurse practitioner, I've cared for so many patients within neurosurgery who needed surgical attention. So I've had a lot of exposure there. I also have been at the university for many, many years. I've been associated with Dr. Frim probably all of his 25 years, but not officially, 18 years within neurosurgery. And I'm thrilled, just thrilled actually, that the Margaret Hackett Family Program is focused on families needing maybe extra resources, and all of us as staff being able to meet those needs, and the Margaret Hackett Family Program leading the way in specialized care for children with congenital disorders. And I'm really thrilled to be part of this organization.
Thank you, Judie. So as you all know, we've been talking a lot about Margaret. You know, the name of the program is the Margaret Hackett Family Program. So Dr. Frim, can you start by telling us a little bit more about Margaret and how you met Margaret?
Well, like most things, when you have a conversation with Margaret, we end up talking quite a bit about a lot of things. So I'll try and be brief, but it may be a little less than brief, I suppose. It was several years ago when Margaret was diagnosed with a disease called craniometaphyseal dysplasia. And that's a syndrome where the bones, particularly the bones of the skull and the spine, the sort of big bones, overgrow what they're supposed to be doing. And so the skull can become very thick and the spine can become very thick. And it starts to compress at the brain and then the spinal cord as it comes out of the skull. Mr. Hackett and Mrs. Hackett had been trying to find somebody who could help treat that. Eventually they found a friend of mine who is not from Chicago, but the Hacketts had been going to a number of gatherings, I guess, that weren't necessarily doctors, but a lot of interested parents. And Hal Recate was the name of the surgeon who said to the Hacketts, and this was in California, where the Hacketts had gone to, saying that, because he knew what craniometaphyseal dysplasia was. I actually did also, fortunately. And so he said, why do you have to come all the way out to Chicago when you can just go see David Frim? I said, why do you have to come all the way out to California when you can just go see David Frim? He lives in Chicago. And so a few days later, we get a call, and then we hear the whole story. And so that's how it all started out. It took a long time to do some of the initial treatment for Margaret, but as time passed by, there were some other problems that came up that we've been able to help with more or less. And so Margaret is still up and around. She certainly bosses me around quite a bit, but I think that that's all for the best. Thinking then about the whole story here, I believe that the Hacketts really wanted to make this go beyond the Hackett family and Margaret's treatment, and then to help many children or many children who were becoming adults, to see if there was a way to add to something in their treatment. And so if you think of it as it goes from the one to the many, now there's many patients who are able to come here. And we've really tried to be very aggressive about finding the patients, trying to figure out what's wrong, and then to try and help them as much as we can.
So you mentioned that, Dr. Frim, that Margaret's father, had explained that it was quite difficult finding care for Margaret 20 years ago, that he, came to the conference to seek out a physician. Why do you think this was the case, and have times improved since then?
So there are a lot of congenital anomalies that start around the central nervous system, within the skull, in the spine, where the nerves are. A lot of them don't have a lot of patients who have the disease. Margaret's particular disease, for instance, is not numbered by how many tens of thousands or how many thousands or even how many hundreds of people have it. There's really probably just a couple hundred in the world. And so there aren't that many people who are interested in a disease that only a few people have. And it's difficult for the patients, if they're not in a big city or whatever, to have the opportunity to meet somebody who is familiar with their disease and who has treated patients with it. So we've tried not to lose sight of any congenital disease. And if it's something we don't really know that much about, then we learn about it as quickly as we can. But we're in the business to try and make the sick people well, and at the very least, we try as much as we can to make everybody as comfortable as we're trying to figure out what's going to be the best approach.
Thank you. So Judie, I understand that you also have a long history with Margaret. Can you tell us about the role that you've played in Margaret's care, and then how you also got to know Margaret as well?
So in planning for this Q&A session, I was trying to remember when I met Margaret, and it's been so long, I just can't recall. I've just known her for so long. My role in Margaret's care is the role I carry for all of Dr. Frim's patients, but for all the neurosurgery patients at the University of Chicago, and that would be I'm one of the inpatient nurse practitioners. So I meet patients, potentially meet them in the clinic if they come for a consultation to meet Dr. Frim. But most of the time, I meet a lot of patients in the pre-op area. They've already met with Dr. Frim. They've already had somewhat of their workup done, that a surgical intervention is necessary. So I meet them a lot of people on the day of surgery, getting ready to go into the operating room. The best part of that day for me is often I get to be with the patient just as they go to sleep. So I tell them I'm a professional hand holder. I tell the parents I like to stand in their place and comfort their child as they go through whatever procedure it is that's planned for them. And the bigger part of my care that I get to deliver is in the post-op area. So once Dr. Frim is finished the surgical care, I get to, consult with the parents. So what's going to make your child comfortable? What medications might work? What position do they like to be in? What can we do to, keep your child comfortable and not stressed and maybe deal with whatever has happened to them in the operating room, and then all the things that come after that. I get to see them in a post-op clinic. Maybe I get to see them a little bit further down the road when they've gotten over the acute care of their surgery and maybe they just need a checkup, or once a year they come and we see how they're doing in school, or we see how they're doing just in terms of life in general. Is there anything else we can do to help with school accommodation or durable medical equipment or things like that? So those are all the things that I provided for Margaret for many, many years. And specific to her situation is she needed many surgical interventions. She had times where she had a significant amount of pain. It was challenging in my role, at least, to try to keep her comfortable and work with her parents and her herself. She was very clear to me what was working and what wasn't working, and then we would try to work together as a team to for her best outcome and obviously for her best comfort. So I've known Margaret for a very long time. I wish I could remember exactly the moment that I met her, but we've had many, many good moments over many years. Probably the best is when she's able to come to clinic feeling good on a good day, and her makeup is on and her hair is done and she's feeling good. Those are the great rewards of doing what I do. So
That's great. Thank you, Judy. So this question is for Dr. Frim and for Judy, who'd ever like to answer first. But, Margaret has such a powerful story. So how have individuals like Margaret really impacted your care of patients? And what do you find to be the most rewarding in your profession when working with, children like Margaret and their families?
I think you get to go first, Judy.
okay. What do I find most rewarding? Well, when kids and parents come back and they have had certainly a satisfying either hospital stay or maybe stint of care. Sometimes we see patients a couple of times in a row, maybe in the clinic over the course of several months, and we'll just call that a stint of care. I call it a season. Sometimes we see patients a few times in a season. And when they feel satisfied that we've been able to meet their needs, and it's not even always necessarily that they got the exact outcome that they wanted, or it's really that we have been able to help them find either a new normal or achieve something that they maybe didn't think that they could achieve. And we've been able to carry along and participate in that journey. That really is the best part of what it is that we do. I think Dr. Frim has always felt really strongly, and he's instilled in me, that it is a team effort, and he's a surgeon and brilliant and does wonderful, wonderful things. And we're able to talk through lots of different situations that we try to individualize to every single child and their family, and where are they from, and what about their life and their lifestyle, and how is it that we can help them the best as a team, him and I as a team, and him and I and the rest of our entire service and our hospital and our institution with the family as a team. That's really been I think the best part. Don't you think, Dr. Frim?
Well, I would agree. For me, every minute is just so much fun. that it's, you know, sometimes it's hard to go home. But then again, it's easy to come back. As far as your question, Julie, for the surgeons, we sort of have a job to do. The first part of the job is educating ourselves as best as we can, and that goes all the way back to being a medical student, really, and learning all the things and continuing to learn more and more, and continuing when there's not anyone who is able to teach you to teach yourself what's going to be the best thing. Interestingly, a lot of that information comes from the patients and the families themselves, because these are rare things, and oftentimes there aren't that many patients in the country or in the world with these rare things, and so we have to make ourselves better so that we can take care of those problems. It's amazing sometimes when we meet somebody with a very, very rare thing, and we learn about it, and we talk to the family, and we talk to the child if they're old enough, to make sure that everybody knows that we're there to help, and we're going to do the best we can. Usually that's good enough, but to get to be good enough, there's got to be a lot of preparation and a lot of thought. And when you see the child wake up from the last operation that we're going to do in a long time, that's just the most incredible feeling in the world. That finally somebody is going to be able to, maybe in a few weeks or a couple of months, to just walk out of the hospital and be a regular person for a while. That's just, there's nothing better than that.
Yeah, I agree. And I think that's one of the most important reasons, why why the Hacketts, really wanted to start the Margaret Hackett Family Program, is because they did have such great care, and they, had such great people to really just listen to them, with so much empathy. Can you, tell us, Judie and Dr. Frim, a little bit more about, why the Hacketts really collaborated with the neurosurgery team at the University of Chicago, to just explain, why the program was developed and what encouraged them to start this program?
You're going to make me go first now, right?
Yep.
About 12 or 15 years into it, I got the idea that we should probably put together some sort of training program, and try and figure out if we could do something that would allow us to be a little bit stronger in the treatment of the children, and then the children when they become adults, who have congenital anomalies in their brain, neck, spinal cord, all of those areas that are sort of part of the neurosurgeon's expertise. And it was a daunting task for quite some time, because there were a lot of things that we needed. There were a lot of people who needed to become interested and want to take care of these children, because a lot of them are very sick, and that can be taxing on somebody. The Hacketts came. They're wonderful people. Margaret being the most wonderfulest. and she really taught us a lot of things about perseverance and about how you can still have some joy and happiness even while you're suffering. So that's a challenge. And so eventually, I think it was Margaret who, not that she came up with the idea, but I think her family was thinking to make a gift to the university regarding the care of the children with the congenital anomalies. And I just remember when we were talking about it with one of the people from the development office, that Margaret was there, and she just turned to her father and said, well, why don't we just, take care of the whole thing? And so it now exists. And so it's going to be a wonderful thing. It's already quite a nice thing because we're collaborating around the country, and people are coming to the hospital to get care. And I think it's only going to get better and better as time goes by.
Absolutely. Do you have anything to add, Judie?
Yeah, it has been a really great thing, and I think what made it successful so far has been the vision of the Hacketts being so family oriented and wanting to share their struggles, but also their successes, and learn from both, so that we can have this resource for other families who may be in a success story or maybe in a struggle, but be able to help them with either. And the Hacketts are really unique in that way. As Dr. Frim was speaking, I was thinking, he was mentioning something about carrying on and doing normal things. I distinctly recall, and I don't remember why this strikes me, but I distinctly recall one of the rooms in the children's hospital, in the old children's hospital, prior to the University of Chicago building a freestanding children's hospital. And I remember Margaret saying to me, and she was in a lot of pain that day and had a lot of headache, and it was not a great day. And I was really struggling, trying to think, what else could I do for her? And finally she looks at me and she says, Judie, I just want to go shopping. And I'm thinking, well, of course you want to go shopping. You're a teenage girl and you're stuck in the hospital. And she just wanted to go shopping and just do something normal. And it always struck me that, we only get to participate, or at least I do, because I'm one of the inpatient nurse practitioners. I only get to participate in one part of their care. But the Margaret Hackett Foundation, I'm hoping, is really going to provide a lot more support in all the other parts of care, or at least enable people to get back to, normal part of life, like shopping. I mean, it seems so simple, and it was such a simple request, and I was so dumbfounded because I thought, I don't know, I got to get you out of pain before you can go shopping, but it's okay. It all worked out. She got shopping, but that's what we're hoping to provide, is more normalcy.
Yeah, definitely. And that's, one of the, I think, unique things about the program, exactly, is we provide, more than just the physician, more than just the medical diagnosis, is we really are focused on the well-rounded care of the patient. Can you talk about maybe some of those unique gaps that we really fill, for the patients and their families? What can we provide, beyond just the medical, experience, the medical advice, what we really work to, how we seek to help families and patients?
I'll let you start that one, Judie.
Oh, well, I think one of the gaps that we're really hoping to fill is the Hackett family really struggled, like Dr. Frim had said, to find the right team, to find the right surgeon, to find the right information, and feel like they were in a path to move forward to help their daughter. And one of the main gaps that we're really hoping to fill across the country is where are these teams, similar to Dr. Frim and myself, but where are these teams? Where can we find medical homes for some of these, for some children who are very complex or have very unusual disorders. And that's what really I find most exciting is finding a medical home, finding someone who's willing to try, finding someone who's willing to walk the road and say, there is this gap and I want to help fill that hole, and having the Margaret Hackett bring all these people together. So maybe there is less holes in care or holes in finding providers, and then to put research on top of that and fill gaps of, at least from my perspective, what is the best nursing care? What is the best in-hospital care? What else can we do in the clinics to keep either patients comfortable or safe, and what can we do in the school? Those are some of the gaps that I really hope the Margaret Hackett Family Program continues to identify and then fill those gaps.
Absolutely.
Yeah, I would agree with that, Judy. It's quite interesting because I think that there's two ways that that we help the families and their children. There are people who come from way far away and have been trying to find somebody, some institution who knows something about their child's problem or their loved one's problem, and then make us, it's sort of like it's an honor to meet those children and their parents and say, wow, this is really great because they came here, so we got to get the job done. And we've certainly met a lot of families who have had long trips to a lot of different places before they found somebody who was able to take care of them. Sometimes we've said, you have a great surgeon in the city that you live in. You don't really need to come all the way to us. But certainly many of the patients have come to Chicago, and many come back every so often, and so that's really great. The other way to look at it is that this is Chicago, and it's 10 million people around it, and there's a lot of patients who have these same problems, and trying to sort of get the word around that we like to take care of these problems. They're challenging. We like it when it's challenging because these problems need to be taken care of, and we need to know how to. We need to study the patient and the disease entity. We need to do the best we can, and I think that in a way it's challenging, but it's also incredibly stimulating to be around with all of these interesting things that we can do to help the patients.
Yeah, absolutely. And one of the things that's really great about the Margaret Hackett Family Program is that we are in collaboration with the University of Chicago, medicine community. Can you explain a little bit more about how U Chicago plays a role in the program?
You want me to talk, right?
Whoever would like to answer.
So the University of Chicago is a big place. Actually, it's a lot bigger now than it was when I first got here, and continues to grow. Not just us, but probably almost all of the units there. But the institution itself is one that is always sort of looking for the answer to a question. And once you get a hold of it, sometimes that question can bother you for years. And it's not just me. I think there's a lot of us who want to find the answer to a question, especially when there's a patient and a family behind that question. And our job is to figure out how to answer that. That's pervasive throughout the whole institution. A lot of people come here to take care of patients because they want to make sick people well, and that is incredibly wonderful to be able to do that. But just as much, there's people who come here because they want to answer the question, so that that answer is not just going to take care of the one patient, but it's going to take care of many patients, especially if they figure out something that hasn't been figured out yet. And so that's one of the best things about it, is that first, we never give up. And second, there's a lot of smart people here. And so it's very unusual that we get to a point where we really can't figure it out. It's been a long time since that's happened.
The other thing is the University of Chicago Medicine strives not just to find the answer to the question, which is so true. The institution as a whole works really hard to achieve the highest level of whatever standard or benchmark is available for the hospital care itself. For example, in nursing, one of the highest benchmarks is to be a magnet hospital, and the university continues to strive to maintain a magnet status and a stroke certification, and there's a newborn breastfeeding certification. So I would really like to see, I don't know, maybe the Margaret Hackett certification for care for kids with congenital disorders or something along that line, but it's nice that the university is always striving for, the highest from a nursing perspective, the highest level of care to each individual family. And so then if we pitch ideas of, what about this or what about that, they're open to that because they would like to find the answer, but they would also like to, really deliver high level, high quality, individual, personalized care to every child. For us, it's children and families, but it's also to adults that have these congenital disorders. We've struggled for years trying to figure out how Dr. Frim and I could reach more people at more age groups with, more disorders. And the Margaret Hackett Family Program might be just that, with the support of the university.
That's awesome. So I know that we've, collaborated with the University of Chicago. We're also collaborating with other hospitals around the country. With that, we're really taking off on the research that we're doing here. Can you tell us a little bit about the research that we're doing and the impact that it's having or will hope to have in the future?
I think that's my turn.
Yep, that one's you.
So overall, the way we set up the Margaret Hackett program is in sort of a few modules, each one having a sort of different a different way of trying to make the sick people well. so part of it is the care that we take of the patients, particularly the pediatric ones, but also the adults who have congenital anomalies. And so that takes a little bit to make sure that along with the surgeons and the nursing care, that everybody has some familiarity with these congenital anomalies on the adult side, and even more so on the pediatric side. And that probably is, in many ways, the most important thing we do, because we're here to make the sick people well. And if we can't make the sick people well, then we got to keep at it until we do. But there's a lot of research that has to go into that, and a lot of energy to try and make things happen that haven't yet happened. One part of the Hackett Center is a consortium of 5 or 6 individual medical centers. We're one of them. And then there's Cedars-Sinai in California. There's the OHSU on the there's the Children's Hospital in Boston that collaborates with us. And there's a hospital in the southern part of South Carolina that collaborates with us. And so we've asked these institutions to collaborate with us because they all have different demographics. And curiously, the diseases that the children have, and a little bit less so the adults, are different in the different parts of the country. And so we're trying to figure out, well, the first question is, why is that? But secondary to that, we all want to learn how everybody's taking care of things in the best way, because we're the University of Chicago, so of course we're really smart. But there's a lot of other people who are really smart. And so part of what we've done in that area is to now start putting together trials that are going to be able to hopefully show what the best way to do something is going to be, and specifically what the best thing to do in a specific place is. So we're just starting that because it's taken quite a long time to get that up and running with all of the paperwork that we've had to do. But pretty soon we're going to be able to be cranking through a lot of very interesting trials on specific diseases. Beyond that, we also have a laboratory. Actually, there's 2 that are engaged in sort of not human problems, but with problems that we are trying to recreate in the laboratory that would be some kind of disease that we would want to try and fix, if you want to think of it that way. The laboratory I work in has to do with injury to the brain, and that's just getting up and going. And then there's another collaborator in Chicago who has been working on hydrocephalus, and that's probably going to be a very interesting collaboration also. That's more to develop to develop treatments, to develop things that we would give to the patient as opposed to operate on them, and that could be, you know, very helpful to a lot of patients. And then beyond that, we do have to have some way to make sure that the children are going to be entertained in a sense while they're in the hospital, because nobody really likes to be in the hospital. And we have to make it some sort of occasion where the patient doesn't just hurt all the time and doesn't just lay around without someone to be with them. And that's also very important. And the one thing that really makes me almost cry is when I walk into the room and I see that the child is uncomfortable, can't get still or whatever, and I'm thinking we got to make this better. And so all of that's important. But I think it's going to get bigger and bigger as the time goes by, and hopefully there'll be some additional collaborators around the country, and we'll be able to start chipping away at whatever we can as far as the disease states.
Absolutely. Is there anything you'd like to add, Judie?
No, I don't think so. I was just thinking while Dr. Frim was talking that children with congenital disorders use a fair amount of resources. And I think we've come a long way in effectively using those resources and trying to keep the children comfortable. For example, the sedation services, when we have to either do procedures or the children have to have, long MRI scans, the sedation services have provided a great resource for many of our patients, but it's it's not perfect. And I think there's a lot of things to come yet to keep the patients, comfortable, but also using their resources effectively and well communicated and even just scheduled well, things like that. Are there particular things about children with congenital disorders that we could do better? And that's what I'm really hoping those things will come out of the, some of the research, or even asking questions as well, not just the science of it, but the art of caring for the children while they have to go through whatever process it is that they're facing or that we're trying to identify and things like that.
That's awesome. Thank you, Judie. Thank you, Dr. Frim. We've also got another question that just came in, and they want to know, how would you like to know how we are collaborating with other organizations? And that is something that we are just really getting started in, right now, is our advocacy and resources. And I think Dr. Frim and Judie have just done a wonderful job of really painting the picture that we are here to, care for patients and their families, in the whole process. It's not just about the medical diagnosis. It's not just about, getting you to see a physician, but we really want families and, children and as adults to feel like you're taken care of. So that's one thing, we've really reached out to a lot of these organizations to see, what else they can provide. And we've really found some really great resources out there. And one of the things, that we found is support groups. So we're really, seeking to have our patients and families, reach out to other people who have experienced the same thing so that you can get connected. There's a lot of virtual groups out there that they meet on a weekly basis, but there's also a lot of, chat groups as well if you've just got a simple question. Another thing, that we want to do is just make sure that, especially kids that just have normal lives, and that they can go out and do things like other kids can as well. So for instance, adaptive sports programming is something that's really important. So they can be in community, they can meet other kids and not feel like they're missing out on anything. Another thing that we're looking at right now is counseling and therapy. We're at probably July, we're going to have a child life specialist come on as well, so that they can really, talk with families and just process about what's going on and just kind of think about, what's going on short term, what's going on long term, how can we assist in the process? And we're also just building out our advocacy resources right now too, is what do you expect, when you come into the doctor's appointment? What are some things that you need to be, prepared with when it comes to insurance, when it comes to maybe x-rays, when it comes to scans, and even, what are the questions I ask during an appointment? What should I be ready for? And then with that, we want to work with other, institutions like, for instance, Chicago Public Schools. We've been on a couple phone calls with them, and they're just asking, what can we provide to families as well, and we can provide checklists, we can provide resources, about appointments. So when it comes to advocacy and partnering organizations, we are really just, starting that process, and we are always open to just what you all want to see and the resources that you need. So I believe that everyone should be receiving a survey after this, and we'd love for you to fill that out to really just tell us, what do you need? How can we help you? What can we go out and find? Because really it's your opinions that matter, and how you are involved in this program is, how it's going to expand and how it's really going to play a bigger role. So we're really excited for all of that. Dr. Frim and Judie, any closing remarks or anything that you would like to conclude this question and answer session with?
Other than it's been our, great privilege to care for so many children and walk a few steps of their journey with them. It truly has been such a great privilege. In the Q&A, one of our moms has said they were so blessed to have found us, and we were just as equally blessed to meet her son, and hopefully we can continue to walk on this journey with many more and with a few more tools in our armament, courtesy of the Margaret Hackett Family Program.
Yeah, we're hungry people. Not so much for food, but for the sustenance of taking care of the ill and the unfortunate, and that gives us a big thrill that we're able to interact and we're able to help somebody who is in need, especially when it ends up being a big medical center with a lot of supports. We should really be making everybody well. And I think that's probably going to be the goal that we're going to continue to strive for over the coming years.
Yeah, absolutely. Well, thank you so much for joining us today, Dr. Frim and Judie. We really appreciated just all of your knowledge and all your expertise, and for just really taking the time, to talk to everyone today. I know Rosa's going to put up some information here at the end for everyone. So if you've got an email address or phone number, feel free to reach out to us with any questions. And then you will also be receiving a survey. So we'd love to hear your thoughts about how we can better provide for you in the future.